Welcome, everyone. This is Earl Stephenson Jr., your Atlanta board certified plastic surgeon, and welcome back to my podcast, Plastic Surgery TNA, and that's TNA, that's Talking Advice. I want to thank you. We talk about all things plastic surgery, and for those of you who've watched before, welcome back. Thank you so much. Those of you who are new, welcome. I'm really glad that you're here. To both of you guys, just like and subscribe to the channel. It really helps empower the channel so that we can do bigger and better things for you. So today we're going to talk a little bit, not a lot of visuals today, but we're just going to chop it up about something I ran into called Tweakments. Now, I've never heard of Tweakments. Have you heard of Tweakments? I've not. So a tweakment is obviously a combination of two words: to tweak, subtle improvement, and a treatment. So tweakments in plastic surgery are vast. In my research, a tweakment can be anything that subtly improves your appearance. That typically has a couple of characteristics, and we'll go through those in a second, but subtly improves your appearance. That can range from things that I think I at least have talked about ad nauseum, and hopefully you're well schooled if you're a return viewer. If you're not, check out one of my other videos, but should be well schooled on Botox, which helps active wrinkles, fillers, which helps volume or places that have lack of volume. So those are tweakments. But did you know that tweakments can also be anything from dermal planing, which you kind of take off a little skin, very thin layer of skin, excuse me, to improve the appearance of the skin. It could be microneedling, which stimulates collagen. It can even be something like a chemical peel. And it can range all the way up to, believe it or not, I don't think this is really a tweakment, but nonetheless, believe it or not, rhinoplasty, it's a big procedure. Eyelid lifts, people kind of downplay that as a itty bitty procedure, but if you really want to do it right, it's a really elegant and demanding procedure. So it's not a tweakment, but anywhere from dermal planing to what I would say is surgery. I don't really want to focus on that. I want to focus on things that you can do in my office or a board certified plastic surgeon's office, or even at home to a modest degree, to subtly improve your appearance. So what we're going to talk about are tweakments, and we're going to talk about three of them, three tweakments. We're going to talk about dermal planing, microneedling, and chemical peels very briefly. So what are the characteristics of tweakments? A couple of things. First and foremost, tweakments are minimally invasive. That means they don't require a lot of pomp and circumstance. So what I mean by that, it's not a surgical procedure. You don't have to have a physical exam. You don't have to have typically any significant after surgery medications. You do not have to go to the hospital or surgery center. You do not have to be placed asleep or put asleep, have anesthesia of any type other than topical anesthesia. So it's minimally invasive. It usually is some type of topical treatment or very minimal treatment just below the surface of the skin. The next criteria that is a tweakment, it's that it produces natural looking results. Again, I don't think that's a quality that's basically singularly to tweakments. Anything that we do here in plastic surgery, especially in my practice, it's natural. We try to go for the most natural result possible. We try not to overstate it unless the client wants it overstated. But our baseline premise is to have natural results. So tweakments are minimally invasive and they are natural or produce natural results. I think the big caveat here is that they are affordable. Now, when you're talking about a rhinoplasty, you may be talking about, depending on the skill level of the surgeon, the problem with the nose that will be corrected, you may talk anywhere from $7,000 up to $20,000, $30,000. So it just depends. So not super affordable for the majority of people out there. Tweakments such as chemical peels and dermal planing and microneedling are very affordable. I've seen broad ranges anywhere from $150, $95, all the way up to about $3,000 or $4,000. So again, depending on where you are geographically, who's performing it, what needs to be done, tweakments still seem to be relatively cost effective. And so a broader reach of people who have interest in their appearance can access these types of treatments. Next, these are flexible. What do I mean by that? What do you mean? What do I mean by flexible? Well, they can really kind of be targeted. If you've got a little volume loss kind of at the corner of your mouth, even though we're not going to focus on fillers today at all, you can use a little bit of a filler like a Juvederm filler just to kind of plump up the corners of your mouth. If you got a little bit of kind of fine lines around your lips, you can use a little bit of a light chemical peel, or if you really want to be super aggressive and clean the slate, you can use a little bit more of an aggressive chemical peel, but you can spot treat areas. So it has some flexibility. You can combine treatments. So treatments can be combined. So it has a great amount of flexibility within the sphere of tweakments, and you can use these obviously before, after, in some cases during larger, more traditional procedures, facelift, eyelid lift, nose job, or rhinoplasty, etc. So they have great amount of flexibility. But the rise of this tweakment is really due, just like I think at this point, everything else in our society, good, bad, or indifferent, is driven by social media. Social media has been really a force in emphasizing what we always have emphasized as human beings, looking and feeling our best. So it emphasizes youth. Everybody wants to be young, but they also want to be wise. But everybody wants to be young for sure. Young and wise is the greatest combination, but sometimes we all don't have all the wisdom that we need, but we always want to be young because we are desirable. It makes us feel good about ourselves, and we're empowered by that. So social media has really taken taking these treatments to the next level. TikTok has been, kind of at the forefront of this. There are a group of individuals now, I think beyond millennials. They're called Zoomers. I'm not real sure about that. That's kind of what I researched, but they're really kind of spearheading this. And then these Zoomers, which are typically clients under 30, are making up a vast majority of clientele that are seeking treatments. So as a practitioner, I want to focus and be able to offer services that I can deliver expertly to everybody. And so, it causes me and old heads like myself to shift our focus not away from our, more mature patient base. And I don't mean that in an actionable way, but just chronologically or by age, an older population, to encompass younger people. Yeah, they're youthful, their skin is nice, but they want to keep it nice. They want to try to, if possible, if reasonable, correct some subtleties with subtle treatment. So tweakments fit right in that, and I need to embrace that. And that's one of the reasons I'm talking about it for my own education, and I'm talking about it for your education in case this is something that's not been in your sphere. So definitely tweakments. So let's start with tweakments. Let's start with our first discussion of our first tweakment. I'm going to talk a little bit about dermal planing. So dermal planing. So you can take a very sharp blade. This is not shaving. It's different than that. It's nuanced, but it's different. You take a sharp blade. You can do this at home. There are many home devices that can be used to take care of skin irregularities just at the surface of the skin. It kind of minimizes or improves, that's probably the better word, improves surface imperfections. It just takes light kind of baby hair, what we call villus hair. Babies that are born with hair is called lango. That type of fine. You don't really see it. You feel it. If the light hits it right, you may see it. You can take that down. You can improve the smoothness of your skin surface. So dermal planing certainly helps that. It helps remove the top layer of those dead cells that kind of give you that dry, age, lack of moisturized look. So using this type of instrument, whether it's almost like a blade or a little machine, to kind of smooth irregularities by removing head and dead skin cells to improve your appearance, dermaplaning is a great way to do that at home to a certain level. But if you have a certain level of imperfections that may require a little bit more, I guess, aggressive dermal planing, even though we're still minimally invasive, you need to see someone like myself, a board certified plastic surgeon, or heck, you can see a dermatologist that's board certified. I think they're equally qualified, or a facial plastic surgeon. I'm not going to sit here and split hairs about these things, about these treatments among different practitioners. I think we're all equally yoked in that manner. So, if you want to have I hate to use these terms, the sharpest blade, the best technology, the quickest technology, the most efficient technology, you're going to be hard pressed to buy that from Amazon. You'll get something that's serviceable. I'm not going to sit here and knock that. If you really want an expert opinion, expert guidance, you really, really want to seek this treatment out from your plastic surgeon, your dermatologist, or facial plastic surgeon. That doesn't mean that they will actually do it, but they will oversee the treatment by one of their team members, typically an esthetician that's been well trained. So this is part of being plugged into the office by having these minor procedures, so that when you are ready for your Botox, or you don't even know you're ready for Botox, these things can be discussed, or filler. Or as you age and go through the seasons of life, you've already established this connection. If you live in the same area, you've had treatment success with the same practice, you have trust and loyalty, and they have loyalty and trust in you, then this is a nice entry point into a plastic surgery practice. All these treatments are nice entry points. So it's great to have that relationship established. So you can certainly have this. This can be done of people of any color. So this is not just for a certain set of people and not for a certain set of other people. This is for everyone. There are certain conditions that don't really lend itself to having dermal planing done at that time. And that's if you have active acne, you've got an outbreak of cold sores. Eczema is not really a great friend of dermal planing, and you really shouldn't do it at a time of I guess a flare. If you got skin growth or moles, you don't really want to shave those. Those need to be treated a little bit differently. Obviously, you've got a sunburn, or you had a burn to your face, and if you had some type of contact dermatitis, I don't know why I'm getting choked up. I've not been choked up all day. All right. So you make sure that you don't have those active things going on. And if you're unaware of that, or don't know, you've got a scaly patch, you don't know what it is. Maybe that's a patch of eczema. Maybe you have psoriasis. You've never had a cold sore before. If you're really a young person and you're not sure, but you want to start this treatment, it's really advisable to reach out to a seasoned office with seasoned practitioners in plastic surgery, dermatology, or facial plastic surgery, so you can establish that relationship. And maybe you go home and do that, or maybe you go in the office, obviously, and get that information, and maybe you allow them to start your treatment, start you down that road. It's really, really a great treatment. Again, the differences of doing this at home versus doing this in my office, there's going to be a different skill level. I'm not knocking you, but I have a skill level. This is what I do. I've been doing this for 20 years in plastic surgery. I've been in medicine surgery for 30 years or more. So I've got a level of expertise because I do it every day. Whatever you do for a living, you've got more expertise than I do. So there's going to be a certain different skill level. Of course, the quality of the instrumentation, as I mentioned before, is going to be different. I'm going to have better quality equipment, which leads to more effective outcomes, in my opinion. I certainly can use my medical knowledge to customize your treatment to make sure that you get the best treatment, as opposed to, you getting a dermal planing device from, again, I'm not picking on Amazon, but Amazon, and you use it. Should you use it? Are you using it correctly? Are you using it in the correct area, in the correct manner? How often? So on and so forth. And of course, if there's a risk of skin irritation, if there is an irritated area after your treatment, then certainly somebody like myself, which lends into the medical skill and knowledge, certainly knows how to treat that area, to get that area healed and promote it back to a state of health. So it's always wise, when in doubt, seek out services from a provider. So that's dermal planing. So dermal planing is something that you can do. I'm not going to sit here and recommend certain home devices because I don't know all the home devices. There's just too many. Again, have these discussions with, I guess, family and friends, but certainly if you have questions, most skincare consultations in most plastic surgeons' offices are free. So, hey, if you got a little time, you can speak, briefly with the plastic surgeon, and certainly speak with their esthetician in a more extended manner. Get some ideas of where you are, where you sit, what's reasonable, what's not reasonable for you to do, or for that office to do. So that's dermal planing. So that's number one. The next tweakment I want to talk about is microneedling. So I think everybody's kind of heard of microneedling, and I think that word has been around long enough that people have a sense of maybe what that is. It is a device that has small needles that punctures the skin. So if that's what you thought, you are correct. That's what it is. So it uses a device that makes small puncture marks in the skin to stimulate collagen production and improve skin texture. Fast forward a little bit, you can combine this. Again, this is the general flexibility of this. You can then use different serums to infuse or cover those areas of treatment, such as a vitamin C, which I think is outstanding. So what is microneedling good for? It's great for acne scars, not active acne scars, but great for acne scars. It's fantastic for surgical scars. Heck, if you had a tummy tuck, your shape is banging, you're looking great, you're feeling good. No, your scar is okay. It's not terrible. It's a little darker. It may have the same texture as your skin above or below. Sometimes you can often microneedle that scar and improve the skin texture and quality of that scar. So surgical scars are great, respond really nicely to microneedling. Stretch marks. Every woman hates stretch marks. Heck, every man that's lost significant weight hates stretch marks. So, stretch marks certainly are amenable to microneedling and improving that. That doesn't mean they get rid of the stretch marks. We're talking about improvement. We're not talking about 100% correction in anyone's hands. Certainly wrinkles, facial wrinkles, sun damage. I would say age spots, brown spots, but commonly known as hyperpigmentation. Enlarged pores, microneedling is good for that. It improves that. And some people will argue that microneedling improves areas of burn. Again, I'm debating that. Typically, you're going to see microneedling used for acne scars, certainly cystic acne scars that are not active. You're going to use them on surgical scars, stretch marks, wrinkles, sun damage, and hyperpigmentation and enlarged pores. That's where you're going to really see this device or this technique really use. What do you expect? It's again, just like the dermal planing, it's something you can do. If you have a home device in your bathroom, If you're in the office, you can drive yourself home. A little topical anesthesia that's placed maybe about an hour before you have the device go over the area or areas of concern. You might need multiple sessions of this. So you may need it more than once. Rarely, I would say rarely, in plastic surgery do you hit a home run. Even with a mommy makeover, to use a bigger procedure, yes, you're going to get 99, 98% improvement. Will you still have a wrinkle there in your tummy? Will it be a little bit of a curve? Will it be a little bit of a bulge somewhere where your breasts have just a little bit of different shape, one versus the other? Of course, nothing's 100. And you may need to consider, if those things are amenable to slight improvement, that you may have to do some secondary procedures, maybe in the office, maybe a little fat grafting to that breast dimple, maybe a little bit of, again, microneedling to the scar. It's hard to hit a home run. And having minimally invasive surgeries or treatment or tweakments is no different. So, microneedling, you may need more than one treatment. It usually takes about 3 to 6 months to see a result. And you might need a maintenance procedure. Once you get to your level of result, to keep that there, you might need at least maintenance procedure once a year. Excuse me, geez. So, when is microneedling problematic? Again, active acne. If you are taking medications to thin your blood, whether it's for a history of a blood clot, whether you have some type of heart condition, your doc may want to tread lightly on providing that service. Now, it doesn't mean you can't have it. This is when you need to go in. Instead of doing this at home, you need to go in to see your plastic surgeon, your dermatologist, or your facial plastic surgeon. They can balance the pros and the cons, speak with your doctor who's managing your blood thinner, and see if the benefit is worth the risk, and manage that, or manage you from before, during, and after, to get you safely through that, and hopefully in a much, much better and more youthful state. So definitely want to do that. Obviously, if you have any area of cancer that you're concerning, or area that looks concerning, you definitely want to do that. Again, contact dermatitis or rash, cold sores, you don't want to do it. Caveat here: anyone who has a history of keloid, typically, I think most practitioners, and I'm going to speak to practitioners and to some, I guess, to my audience out there, because they may not know, but most practitioners and lay people think keloids are a problem of people of color, African Americans. And they are right. It's a large segment of the population, African American population, can have problems with keloids. And you got to make sure that you understand that first before you have any type of procedure that breaches the skin. So we definitely want to make sure that that's not an issue. But keloids can form in Caucasian people. People can have keloids that are of Asian descent. So I think it's a relatively reasonable question to ask of all clients. So if there's a history or a tendency, then you're not a candidate, at least in my office for sure. You're absolutely not a candidate for microneedling. Again, if you have skin tags or moles, we don't really want to do that, especially if a mole is changing shape or size. We definitely want to make sure we biopsy that and make sure we don't miss anything that could be a problem, such as a melanoma, which is a very lethal skin cancer. Again, autoimmune skin diseases like eczema or psoriasis, you don't really want to certainly microneedle an active area. You may want to tread lightly on people who are, quote, in remission or not having active flares, because you may promote an active flare. Again, this is a discussion that you go to your practitioner for, and they have the discussion with you, and they size up the issue. And then if they need to talk to your dermatologist or rheumatologist about these things, they can make the best judgment to see if you are an appropriate candidate, and if you are, how to best manage you during the treatment and after, so that you can have a successful outcome. Microneedling, like I said, in-office procedure, topical local anesthetic. It can take about 30 minutes, maybe 45 minutes, depending on what you're microneedling and how big it is. And then you get aftercare. and you frequently see your practitioner for follow up. And like I said before, it may need multiple sessions. So that's microneedling. Again, can be done at home with devices bought on, Amazon or other places. But again, not as effective as in a professional office. If you have any medical issues, then you want to halt. You don't want to do that at home. You want to seek advice from a medical practitioner. Lastly, the third tweakment that I'm going to talk about. Again, I'm not going to talk about the vast majority of tweakments. I will be here all night and you'll tune me out in 2 seconds. We're going to talk about chemical peels. We're not going to talk about lasers. Lasers can be considered a tweakment as well, but I'm going to hold that off and we'll maybe talk about lasers as a subject in and of itself. But we're going to talk about chemical peels. So I think chemical peels are a really easy treatment to perform in the office. You got to be prepared for that. In my opinion, these chemical peels, certainly peels that have significant recovery, and I don't mean significant recovery like you're in pain and you got to be out for 2 months, that you're actually going to peel and you're going to have a nice result. You probably need to do these types of treatments when there's minimal sun exposure, which is typically at the beginning of each year. You're not trying to do a really significant peel like a TCA, which is a trichloroacetic acid peel, where you get a good peel and good new skin that looks great. You're not trying to do that in July. You're trying to do that in January. So definitely these treatments, these chemical peels as part of tweakments are done typically at the beginning of the year. And what a chemical peel is, I like to call it, and this is a little scary, but I think patients can kind of understand, our clients can understand, this is a controlled burn. You'll see big words like, oh, this is chemical exfoliation. This is a controlled second degree sunburn. And that's because as plastic surgeons, for sure, we are trained in traditional burn surgery, where we have to take care of people who've had major burns over large percentages of their body, including their face. We have a certain level of comfort that I think is unparalleled compared to with other practitioners in this space. And I will split hairs here. So it's a controlled burn. You can use certain types of peels to penetrate to certain types of depths of the skin. You have very superficial peels like alpha hydroxy acid peels or fruit acid peels. Glycolic acid is a fruit acid peel that just worked very lightly at the very superficial layer of skin, causes a little flaking in people or clients, especially if they're not really consistent with skin care. It may cause a little flaking that you kind of moisturize, and if in 2 to 3 days that's gone and your skin gets a little bit of a pop or glow. That's a great treatment, not very expensive. I can't quote other people's offices, but it could run anywhere from 75 to $100. You get a pop and your skin looks great for 3 or 4 weeks. You want to make sure that you treat these areas or your face frequently with fruit acid peels so that you can keep that level of pop or glow going. So you can use fruit acid peels or light level or superficial level peels. You can do kind of a medium depth peel that gets below the skin, maybe into the collagen, so it can reorganize and smooth the collagen. So if you have kind of deeper wrinkles, as opposed to a fruit acid peel where you may not have any wrinkles, but you're really trying to preserve and freshen and brighten your skin. When you have some character lines around your mouth, around your eyes, and your cheeks, you may want to use a medium depth peel. And there are many medium depth peels. I am partial, or I like TCA or trichloroacetic acid peels. Those peels come in different strengths, 5% to 50%, and it's the experience of the practitioner, the client in front of you, what their needs are as to what strength you may use. And these again are the peels most definitely you should be doing in January as opposed to July, because this is going to require, again, in the office, topical anesthetic, probably about 30 minutes of self treatment, but you're going to have significant peeling and you'll need a significant aftercare program to keep the areas moistened, to allow the area to peel, to protect the area once it's peeled so that it blends and is a nice natural result. And then you can have really deep peels. Again, this is probably a little bit out of the area of tweakments. You can have a phenol peel. I don't think people are doing straight phenol peels anymore. They're certainly doing some modification, kind of a croton, Croton peel, but you can take care of some pretty deep wrinkles, typically around the mouth. But I think in this day and age, a strong TCA peel is a very nice peel to perform, to really get some smoothness to the skin and make it more youthful. It can do some minor tightening. It's not a facelift, but it can do some minor tightening. And you can use this again. It's the flexibility. You can use this after someone's had a facelift. Some people will peel at the time of facelift. I'm a little skittish. Don't know if I would do that. Some people may do that before facelift. It's really dealer's choice. You want to make sure that you pick the right treatment for the right patient. Now, there are chemical peels that you can get from, again, other sources and do these at home. They're typically fruit acid peels. They're probably a lactic acid peel, or you've got some kind of wash with a lactic acid peel. That's fine. You could do some slightly stronger peels that are more focused on your face. I would do these with caution, or perform these with caution, because if you don't know how to handle these chemicals, they can injure your eye, your nose, injure the lining of your nose. If applied incorrectly, it can cause deeper levels of penetration because you're sopping it in a particular area that you really want to hit, and you get really depth of penetration that you shouldn't, and you end up with a big burn. So, if you want to do a kind of a wash with your typical wash from, if you get a wash from Sephora or you get it from wherever, then fine. But if you really want to hit some areas hard with a peel, I strongly advise that you seek the treatment of a plastic surgeon, dermatologist, or facial plastic surgeon, because the management of these can be tricky. The application of these can be trickier for stronger peels. And so you don't want to get yourself in a quandary. So, when are chemical peels not indicated? Typically for the same things that we just talked about with the other treatment modalities. So, we want to make sure that we watch out for that. Chemical peels specifically, and I want to be clear about this, can treat certain types of acne. If you have a salicylic acid peel, which is a beta hydroxy acid peel, a lighter peel, it's great for skin texture and it's great for acne. Again, if you have active acne, then that's what you choose. But if you don't have that knowledge and you try to apply that at home, or don't apply that at home, it's not going to work for your acne. You can treat mild sunspots, age spots, freckling, and patches of melasma, typically due to pregnancy, or taking birth control. But you may need some other things to go along with that to treat those areas, and you may need more than one peel. Again, chemical peels, no matter the strength, are not substitutes for facelift. If you need a facelift, you need a facelift. You just need to go from there. But typically, treatments are for younger individuals. And so if a younger individual has been a sun worshiper in their early 20s, now they're in their mid 30s, and they're not really looking like they want to look, then a chemical peel may be great. Certainly a TCA peel would be fantastic. You want to be careful with peels. Unlike, dermaplaning for sure, and to some degree microneedling, chemical peels ain't for everybody. If you are a person of color, you need to tread lightly. You need to seek out practitioners who are experienced with peeling people of color. And that practitioner needs to be super conservative if he or she thinks that you can benefit from a peel and move forward. The last thing anybody wants is to have a peel, have the peel work, and you end up with areas of darkness and lightness and uneven skin tone that is difficult to correct, incredibly anxiety provoking because of the way you look, and it's just a bad deal all the way around. So be very, very careful. If you are a person of color, you suffer from acne or, dark spots from ingrown hairs or melasma, you want and you have to and you need to seek out your dermatologist, your plastic surgeon, or your facial plastic surgeon for expert opinions. So please, please, please do that. Couple other caveats about chemical peels. Chemical peel is great, but you really need to make sure you treat the skin before and have it prepped and treat it afterwards. I like a good retin-A. It's a daily, and not a daily use, but 3 times a week as part of your ongoing routine maintenance prior to any chemical peel, and certainly at some point after. We want a good moisturizer and we want a good sunscreen. And you just need that. That's just like getting up and brushing your teeth. You get a chemical peel, if you've been doing that before, your skin is pre-treated and preconditioned, and it'll have a fantastic result. If you've not had a chemical peel and not been doing that, I try to make sure that we implement that as a starting foundational point so that we can have that on board for 4 weeks, 6 weeks, 8 weeks to get your skin prepared and then peel you. Of course, we're not doing the retin-A and all that stuff while you're peeling, but once you've peeled, we protect it with sunscreen, we moisturize, and then we reintroduce our retin-A. We've got to have those foundational things in place. So again, I just want to talk about tweakments. I keep wanting to say treatments because, again, that's not terminology that I use. Tweakments are very powerful. If you're sitting home and you're looking at yourself, or you're a young person, you're taking a lot of selfies, you're taking a lot of pictures, you're hanging out with your friends or your girlfriends, and their skin looks fabulous. And, what are they doing? What can you do? You've done all you need to do or all you can do at home. Plastic surgery has such a bad stigmata, rather. It's okay. Just get some insight from a plastic surgeon. You can come in and have a chemical peel, a light peel. You can come in and have some dermal planing or, microneedling. It's okay to kind of keep your skin as youthful as long as you can. No one can beat the age process. No one. So when you have it, you think you can improve, you're young, it's okay to seek the information, and you may decide it is for you or not for you. It may be now or it may be later. So don't be embarrassed about that. There's nothing wrong with self-improvement. So on that note, shorter version of my podcast, wanted to talk about tweakments. I appreciate you guys tuning in. It's always a pleasure. And I really, again, would love for you to like and subscribe so that you can support our channel. And for those of you who have done that, thank you for your support. Really do appreciate it. Remember, Plastic Surgery TNA is here every Saturday on YouTube. It's usually after 11 a.m. that the stream is available. So share this with your friends. Hope this has been valuable to you. Please stay well, be well in these unusual times. Peace. See you next week.